So today we'll be going over drug overdoses, specifically opioid overdoses. Some of you may have seen the topic of opioids in the news, and some of them are describing the topic as opioid crisis or opioid epidemic. Hopefully, after today's presentation, you'll be able to see what sets this out of the norm for other overdoses and what really does kind of make it an epidemic or a crisis. We'll look at the scope of the problem so you can see just how large it is. Then we'll move on to kind of how it all started, what led to the problem. We'll look into things and factors that played into making the problem larger, what escalated it into something bigger. We'll look at where that ended up, and we'll look at certain solutions that are out there right now, some that are less effective, some that are more effective, and then we'll go over what can possibly be done moving forward in the future to help the problem. But before we move on, I'd like to give credit to the other contributors who helped with the presentation: Megan Beals, Casey Mitchell, Haley Thompson, Samantha Spees, and myself, Kevin Gizek, will be narrating our presentation today. So, opioid overdoses. Why is this something that we should care about? Why is it something worth discussing? Well, there's a very large economic and an emotional impact that comes with these overdoses. There's a very large amount of time, money, resources that go into managing the aftermath of these overdoses. And there's also an emotional impact. Of course, people are losing their loved ones, their family members, their friends to these overdoses, to these opioids. So I think it's worth discussing and remembering that magnitude we talked about of why it's considered a crisis or an epidemic. It was estimated the total economic burden to be close to $78.5 billion. That's a billion with a B. So it's a very large amount of money and resources that are having to go into managing this. So let's talk for a couple minutes about what exactly opioids are and the scope of that problem. So as I mentioned earlier, you may have seen news articles that mention opioids but don't really understand what they are. Opioids, generally speaking, are just painkillers. So you might have been prescribed a painkiller after surgery or even something minor like having your wisdom teeth removed. These opioids are marketed under certain brand names like Oxycontin, which would be generic for oxycodone. You have hydrocodone, which would be Vicodin, or Norco, codeine, morphine. Those are all examples of opioids. It's not just prescription painkillers, however. It's also heroin, which works the same way in the brain as opioids. And then you have fentanyl, which was introduced somewhat recently as a way to try to manage the tolerance that people are building towards the prescription painkillers. Some of them were reporting that since they had been on these opioids for so long, it was no longer treating their pain effectively. So just to put things into perspective of how large this epidemic has become, drug overdoses have killed close or a little over 63,000 people in 2016. To put that into perspective, more people died in 2016 than died during the Vietnam War. So it's very, very large. It's estimated that close to 115 people die daily from opioid overdoses. So it's very much an epidemic and a huge problem. Here we can see the highest states with the highest number of opioid overdoses. The main takeaway are the four states: Pennsylvania, Kentucky, Ohio, and West Virginia. It's interesting to note that West Virginia has a significantly higher amount of overdoses than the second highest state, Ohio. So it's important to note that there's clearly something going on there. So now that we've talked a little bit about how large of a problem this opioid epidemic is, I think it's important to talk about how this problem started. How did it get so out of control? It was during the late 90s, doctors were noticing that so many of doctors' visits discussed pain as a symptom, and it turned out that almost 80% of all medical visits discussed pain as a reoccurring symptom. So, large government agencies and advocacy groups, specifically the Veterans Health Administration and the American Pain Society, started to enact guidelines that were to try to help doctors establish the best way to treat pain and also to kind of demand change. At the time, there wasn't much being done about pain. They felt like it wasn't enough. So the idea that these agencies had was that if they had put more pressure on doctors to better treat pain, that we would have new and improved ways to do so. So, unfortunately, during this time, large pharmaceutical companies took advantage of the opportunity. They saw a way to make a very large amount of money. The increased awareness in pain treatment led to pharmaceutical companies recognizing a growing market with potential for very large profits. Unfortunately, the pharmaceutical companies continued to deny the risks of opioid use and even marketed them to prescribing physicians as being harmless. Unfortunately, the false information led to doctors overprescribing powerful opioids without really knowing the potential consequences. During the time, the rate of opioids tripled up until 2006. Unfortunately, after that, pharmaceutical companies continued to assure doctors that the risks involved with opioid use was minimal and that the potential for addiction was not much of a concern. So, whenever we hear in science, and especially social science, that science is self correcting, we know that there has to be multiple research studies done before we accept something as truth. Unfortunately, that didn't happen. There was a very limited body of research to support what these pharmaceuticals companies were saying. Unfortunately, since there was so much pressure placed on these doctors, they kind of accepted it as truth. They felt so much pressure that they needed to move forward. So let's look at where all of this ended up. Individuals who were seeking treatment for chronic pain unfortunately saw themselves faced with a huge problem, which of course was addiction. Remember earlier we talked a little bit about how there was a very limited amount of research that these pharmaceutical companies cited to doctors. In that research, they told them that tolerance and addiction were not a factor. It wasn't something to be concerned about. We now know that that isn't true, of course. Opioids definitely are something that the body builds a tolerance to. So you may take a certain amount of an opioid and it helps with your pain, but we find that the longer you take it, it no longer works. So unfortunately, you need more and more and more of those opioids to help with that. So there's a bit of a chain of events here that happened that really helped to progress the opioid overdoses. And that's when addicts who became so tolerant to these painkillers started turning to buying their drugs on the street. So unfortunately, they were going through their prescriptions so quickly that they would go into withdrawal when they didn't have any more left. They would turn to street dealers. And it turns out that it's actually much cheaper to buy and make heroin than it is those prescription pills. So when it becomes unmanageable financially for opioid addicts to handle, what we're seeing is that they're moving more towards heroin. Unfortunately, between this time, between 2002 and 2015, we saw an increase over 6 times the average amount of heroin overdoses. It's notable that all of this started during the late 90s, and then we're seeing that closer to the 2000s, 2001, 2002, is when we're having a much higher overdose amount for heroin. So you might be wondering why, if all of this started in the early 90s, early 2000s, are we seeing the effects of it still now in 2019? Well, it's pretty easy to make a mess of things pretty quickly, and it usually takes a long time to clean up that mess. Unfortunately, when we have ideas for solutions, we don't always know if those solutions are going to work until we try them. So, one of the solutions that we've come up with is medication, again, like methadone and Suboxone. These medications are used for multiple purposes. One of them is to not only decrease the symptoms of withdrawals, but also to try to curb cravings for these opioids. What we're seeing is that methadone was successful in France and in other countries, but it had an inverse effect in the United States. Unfortunately, we saw a 468% rise in deaths related specifically to methadone. So what happens with methadone is in very large quantities, people can take those medications not only to help decrease the symptoms of withdrawals, but they can actually also fuel their addiction. Methadone in large amounts can cause addicts to find that euphoria that they felt when they first started taking opioids. Since many of these deaths were specifically related to methadone, many people are arguing for daily distribution of methadone. So you might have heard of methadone clinics or addiction sites where methadone is administered daily. So the idea here was, well, if people are using methadone to fuel their addiction and they're overdosing off of that too, then instead of giving them a weekly or a monthly supply, why don't we give it out daily? Meaning that person would have to go to that site every day and be distributed a single dose. They return the next day for the duration of their treatment until they no longer need it. Unfortunately, there is a lack of adequate funding for mental health that has made it significantly difficult, and many people find having to go there daily to be cumbersome and somewhat of a struggle, so then they give up and go back to addiction. Others have proposed another solution, which is checking technology, or in other words, harm reduction services. It's always been a great topic of debate and controversy with harm reduction. Some people think that by only trying to reduce harm, it's saying that we're going to allow it. In other words, it's okay to continue to do drugs, just be careful. So that's where some of the controversy with that comes with. With checking technologies, the idea is if we allow addicts a way to determine if the drugs that they're purchasing are safe or there's a purity with them, then overdoses will be reduced. So remember earlier when we talked about the chain of events that had happened when addicts who were beginning to purchase their prescriptions on the street for very large amounts of money could no longer afford it and then moved on to heroin. Unfortunately with this, there's not really a way to know a purity or whether or not there's nothing else mixed in with that heroin, which is why we saw a large amounts of overdoses related to heroin. It wasn't necessarily the heroin itself, it's what everything else that was in it, specifically fentanyl, which is also an opioid that's anywhere from 10 to 50 times more potent than heroin. So if addicts are used to using heroin at a certain amount, they should know how much they're able to use before overdosing. Unfortunately, when it was mixed with fentanyl, which was significantly stronger than what they were used to, we were seeing higher rates of overdoses. Unfortunately, with drug checking technologies, not many addicts were utilizing this. And there's a big lack of research on whether or not it's something that's actually going to be beneficial or really works. So although not all of the solutions that have been proposed and tried for the opioid crisis have been successful, I think that the most successful one that has worked so far was the introduction of a medication known as Narcan. Narcan, it was similar to how an EpiPen would work for somebody who's having an allergic reaction. So it can be used as an injection, like an EpiPen, or it can also come in the form of a nasal spray, allowing for an easy administration to people who are overdosing off of opioids. It's meant kind of as actually a reversal of overdose. American Airlines just joined United Airlines with their commitment to providing Narcan. Just like we saw with the other solutions that were proposed, Narcan, of course, also has its drawbacks. Unfortunately, the medication is very expensive because there is a lack of generic options available. So, of course, paramedics, EMTs, firefighters, police officers who are first responders are equipped with Narcan to carry with them to be able to respond to these overdoses. But there are also other members in the community who could also be considered first responders who would really benefit from having access to the medication. So although Narcan also has its drawbacks, namely it being so expensive, it really is large amounts of money on moving forward and helping to prevent opioid overdoses. The great thing about Narcan is that it can reverse the effects of opioid overdoses within minutes, meaning it has the potential to be life-saving for thousands of people. And because of that, many agencies have found ways to make Narcan more easily accessible. So moving forward with Narcan being the best solution for opioid overdoses, I think community access is something that really needs to be addressed. specifically with County Board of Health websites and public forums. It really comes with education and having hard conversations about hard topics. If people are more educated on the topic, they may be more likely to respond in a way that would be life saving. A study that was conducted by the Staying Alive program found that participants who had gone through training went from not really knowing how to respond to an overdose to feeling more comfortable and knowing how to administer Narcan and how to respond to an overdose. If we have more of those people who are educated in the community, I think that we would see a really big decrease in opioid overdoses.